Welcome to the Baseface Network.
Assalamualaikum to Madam Nur Hidayah. My name is Muhammad Azmadaniel bin Abdul Aziz. Matrix number DPC 04220005. In this video, I will be talking about first aid. So, what is first aid? First aid is immediate emergency care or treatment given to an ill or injured person before regular medical aid can be obtained. The objectives for first aid is to preventing the injury from getting worse, to relieve the pain, to save lives, and to protect the unconscious patient. These are the types of injuries that can be happen in our real lives. We have hemorrhage, burn, musculoskeletal, and hyperventilation. We have 8 steps for general management for first aider. D for danger, R for response, S shout for help, A for airways, B for breathing, C for circulation, D for disability, E for exposure. This is an example of the incidents that can be happen in our real life. You and 2 friends were doing experiments in laboratory medicine. Suddenly, a minor explosion occurred. You have noticed that your friend has bleeding on her face and finger. In your role as a first aider, explain how the management should act. What should we do? The first thing first, we must not panic. And remember the general management, which is 8 steps for first aider that we must follow. The first step, we have danger. As the first aider, we need to assess the situation before taking any actions. Quickly move the victims to the safety areas. Identify the possible hazard. Stay away from danger. Prioritize personal assistance, victims, and bystanders' safety. For the response, we will use AVPU criteria, which is A for alert. The victims is aware of the examiner and can respond to the environment around them independently. The victim can also follow commands, open their eyes spontaneously, and track objects. V for verbal. The victim's eyes do not open spontaneously. The victim's eyes open only in response to a verbal stimulus directed toward them. The victim can react to that verbal stimulus directly and in a meaningful way. P for pain. The victim's eyes do not open spontaneously. The victim will only respond to the application of painful stimuli by an examiner. The victim may move, moan, or cry out directly in response to the painful stimuli. And U for unresponsive. The patient does not respond spontaneously. The victim does not respond to verbal or painful stimuli. Shout for help. Call the lecturer who is in charge of the laboratory. We also need to call the laboratory assistant for the further checkup. If the case is severe or critical, we need to call the emergency number, which is 999, to call the ambulance for help. For the airways, we need to check if the victim is still breathing. We need to remove the foreign object on the victim that can block the victim airways from breathing. Number 5, we have breathing. Check if the victim is still breathing by watch the victim chest move. Use the oxygen support if needed. If the victim is still not breathing, do the CPR. After the CPR and the victim is still cannot breathing, we need to call emergency number, which is 999. For the circulation, we need to check for the sign of bleeding. For this case, the victim was bleeding on her face and finger. So we need to assess the site of injury, which is on her face and finger. We need to clean it up by using the clean water to remove any contamination of microorganism. Then we need to stop and control the bleeding by using the direct pressure method. We need to do the pressure directly on the wound to stop the blood flow. Cover the wound with a clean cloth or sterile gauze. Irrigate the wound using aseptic solution. This ability. Assess the range of movement. We have to use support equipment for splinting if fracture happen on the part of the victim body. And lastly, we have exposure. Check for other hidden injuries that may happen on the victim. Lock roll to check at the back of the victim body. For the conclusion, at some point in everyone's life, he or she will receive or give first aid. Early response can increase the likelihood of a favorable outcome of an emergency. It is important to help the victim as much as possible, but early notification to the proper medical professionals in your community will ensure the best outcome for any victim. Remember to always ensure scene safety and dial 999 when necessary before assisting a victim. Here's the link that I use for the reference in my video. Thank you. I hope this video can help us in the future.